Lemon.
So hi, good evening. Welcome to the IBD and Ostomy Support Show. I'm Louise, aka Crohn's Fighting. Apologies, we haven't been on for the last couple of weeks, but we've all been extremely busy with work and life, and just we've just been
being
busy.
Poorly as well.
Being poorly. I've spent most of this week in bed. Yeah, I have actually spent most of this week in bed. Today's my first day sort of out and about and alive, so to speak. I don't know what it is. I don't know whether I'm just run down or tired, but my head's been feeling like concrete. I had the coughs and the sniffles at the beginning of the week. I'm currently having to go intermittently between having my hand bandaged and unbandaged because I keep losing like muscle sensation in my hand. So I'll be holding something and then my hand will just go to sleep and I can't feel anything. So I was trying to drive back from Sevenoaks on Sunday with my left hand.
You had carpal tunnel, have you?
I did when I was pregnant with Maisie, but it hurts to pick things up at the moment as well. So if I bend my hand a certain way to like pick up a remote control or even my phone, my whole hand just goes into spasm and it locks. So I'm not too sure if it's trapped nerves. So I've just got a bandage wrapped really tightly on it at the moment. I'll take it off before I go to bed. But it keeps waking me up. It keeps waking me up in my sleep as well. It keeps waking me up in the middle of the night. So what else has been going on? So I've been up and down the country quite literally the last month doing presentations in Swansea. I had a presentation last week over at Haywards Heath, which, by the way, I was absolutely cacking my pants driving through there because it's like deer country. So it's one of those ones where there's like an enforced like speed limit of 40 miles an hour for a good 40 minutes of the journey because deers like to come out and jump in your car.
He's cacking your bag. I think you'll find.
Yeah, pretty much. So it's driving through deer counting. As I was driving past Ashdown Forest, there have been 244 deer incidents on this road in the last year. I'm like, please don't be 245. Please don't be 245. Yeah, so I was driving through there, and then there's a bit through Greenbridge that I have to drive through, and it's really not a nice bit of road at all. So I had to do that. I've got a hospital appointment on Monday. I've got a hospital appointment at the end of this month. The end of this month, I'm also up in Birmingham because I'm doing the Purple Wings charity show. Birmingham.
No. Birmingham.
It's not. It's Birmingham.
That's right, girl.
So I'm up there. I'm going up on the Friday night and staying in a hotel because the time it starts, I'd have to leave at 5 in the morning. I'd arrive looking like death. No amount of makeup would cover the bags. So
which bags?
The one's under my eyes, the other one's absolutely fine. That's got to be out anyway, so there's no reason that is there. So yeah, I'm doing that. So yeah, my consultant and that seemed to think I have a fistula, so that's all going to be fun and games because I've had one before and I know that they are notoriously stubborn and difficult to get rid of. I went for my smear test. Couldn't have my smear test done. I've got to go back to Guy. I need to have it done because they need a miner's lamp and a shovel to find my cervix. So the joys of Barbie butt surgery for being a female. And that is pretty much life in general. Tonight we are covering hospital tests, scans. So we'll be covering things like the difference between an endoscopy, colonoscopy, flexible sigmoidoscopy, gastroscopy, MRIs, that sort of thing, because I think we've all been there, done it, got the t-shirt, gone around the world with it 30 times, and then come back down again. So I shall pass you over to Rachel.
Hi, I'm Rachel, aka Rocking Two Stomas. Trying to remember then what to say because it's been so long. Yeah, so what have I been up to? Boy, I've been very, very, very busy. To the point where I do feel I've hit a bit of a wall. So I've been to like Louise, I've been to Eastbourne for talks. I went last week. I went to Peterborough Monday. I did a talk to physiotherapist today. I've done talks with Southampton to the urology nurses. I've got more talks coming up, and it's really great. I've got this work that I do as well with the scheduling and social media, and I realised that the last two things today I've scheduled on Rocking Two Stomas as the wrong one. I have to go back, but and it's I really enjoy it, but I'm just finding it's a bit difficult trying to balance everything. There's so much. I've got I just had this. I haven't had it yet, but I'm really proud that I've got an article's been published in the gastrointestinal nursing about the ostomy, the poor relation. And I'm really proud of it. And I haven't got the article yet, but it was written really well. Thanks to Colostomy UK helped me, and John McCrath helped me, and it's done really well. And I feel proud of that. And I've got a few other journal articles coming out, so I've kind of been busy trying to cram it all in. And I think I've lost an element of me, and I haven't had time to blog much. And I'm trying to sort of readjust it. There's problems with my website, not able to. For some reason it's not working properly. I'm not able to I want to schedule a post I've done, and it won't let me post it, and my website designer's away. So when he's back, I'll hopefully be back blogging, use my Facebook a bit more. I'm on Twitter, but to try and sort of deal with that really. I saw Steve on Monday, which was nice, in Peterborough with Colopass. That was nice. And yeah, I've last minute on a whim, she says, booked a holiday to Egypt on Thursday. And I think Monday night when I was in the hotel, I had a massive panic, and 3 a.m. I wrote in the double bag group, please tell me somebody with a stoma has been to Egypt and they've had a positive experience, or someone Tramadol. And actually I've covered it all. I've got a medical letter. I think it's going to be okay. I won't eat the salad. I won't eat the ice. Eat the ice. Drink the ice. I just need a bit of a holiday and a bit of a break, because I think I've just kind of burn out a little bit, and I'll come back hopefully refreshed and a bit of a tan and feel more like me. So I am looking forward to it. I'm hoping everything goes all right, and there's no food poisoning, as lots of people keep telling me that I maybe didn't think it through fully, possibly, which is a very Rachel thing to do.
Isn't it just?
Like, yeah, last minute, I've just done this, I've booked the holiday to yeah, I'll let you know how it goes, and I can share my story back if hopefully positive. But I'm looking forward to swimming with the fishes. Steve, don't read comments. Yeah. No, you're gonna say that. And
I'm watching Goodfellas of you, right?
Yeah, I love Goodfellas. Yeah, I think I've had a bit of a reflection, being like, I feel like I've sort of neglected it because I've been struggling, and like, you know, I think lots of people know that now that Steve and I aren't together anymore, and I think it's been really difficult, and I think I've just really struggled. I've isolated a bit, and I'm sorry if I've not responded to messages, and I'm going to get a bit tearful. It's been a bit difficult, so I think I'm hopefully coming out of that and be able to sort of, because I feel like I'm so busy and I don't know where I'm going at the moment. So hopefully I'll be back doing more what I usually do, and back to kind of being me. So hopefully the holiday will help. Right, moving on swiftly, Steve.
Hi, I'm Steve, aka #Baghdaddy Steve. Yeah, like I said, I've just returned back to work after 4 months off from my surgery. I've suffered quite a few depression, anxiety, all the other things that come with it, with surgery, with you know, just being stuck on your own for quite a while, having all the time in the world to think, and whereas before I didn't have time to shit, let alone think. You know what I mean? So I've been back at work a couple of weeks now. Well, it'll be 2 weeks tomorrow. Phased return, 5-hour days. So I'm just getting to wave goodbye to everyone, and they've still got a few hours left. But
you part-time working.
So I'm getting it all. I'm getting it all. Half a daily, they're calling me. But, yeah, it's nice to be back. You know, I've the last month of me being off, I kind of really started to enjoy it, to be honest, because my tablets kicked in and my head started to get more level. I saw Rachel the weekend. No, sorry, was it yesterday? Day before?
Yeah,
yeah.
In Peterborough, Coloplast. That was a really good get together.
Monday and Tuesday. It was.
Yeah, like-minded ostomates talking to the marketing people about different. It was just really interesting day, and you got to hear lots of people talking, around the table about just ways of dealing with stuff and things that we can help them with as a patient or as an ostomate. That was good. I've been growing beards. That's what I've been doing for the last 3 months, 4 months.
And your new tattoo, you got to show everybody.
I've got a new tattoo. Yeah, my new tattoo. I've got my shield maiden on my shoulder. I'm a bit into the tattoos at the minute. Hopefully, my tattoo artist is going to do my whole back for free. So we'll see about that. That's like a warrior scene.
And there's me with my $12.95 a month Birchbox treats to myself. It's really good actually. It come with a clay face mask this month, and I really need it because my skin is awful at the moment.
Well, I was just getting. Sorry.
Sorry, I was going to ask you, Steve, like with the anxiety and the depression, have you been having the moments of just pure blind panic and you don't know why you're panicking?
The first 3 weeks of taking sertraline, because I was quite an emotional wreck, to be honest, and I couldn't figure out what was it all about. I've never really been through that before. And the first few weeks of taking sertraline, I felt awful. They warned me about suicidal thoughts. Now, that's never going to happen, because I've got kids and I just couldn't do that. But, you feel absolutely awful and can't really explain nothing. But, I've been doing I did 6 weeks of yoga, which Birmingham Mind, went through Birmingham Mind. So that was really good. It's kind of got me to think differently, to breathe differently. It's been really sort of beneficial. I've had this stinking cold for the last 3 weeks now. Hopefully it'll run its course after a couple more weeks. The first few days was just pure banging headaches. I couldn't shift it. And then it's just sore throat and coughing through the night. But my sexy voice is still there. So we're getting there, you know what I mean? And that's kind of really where I'm at, really. I've been sort of taking it easy and I've enjoyed the last month off work. It was a bit of a shock to the system from getting up at 9 o'clock just to go to have a wee and then go back to bed. And now I'm getting up at 5 o'clock and having to go out into the cold to work. So we'll get there in the end. And I go up another hour. I think another hour next week. So we're moving in the right direction.
I don't know. I've been having mad moments. It was we went to go out the other week, and the night before, Ben said to me, "Oh, did you book Bedbury?" And I thought Bedbury was Leeds Castle. I didn't, blonde moments. So I've booked it. It's done. It's dusted. Well, anyway, little did I know, Ben's driving towards Bedbury, and I'm going, well, aren't we going the wrong way? Because it's at Leeds Castle. And obviously he had the ump with me a little bit, I think, because obviously I said the night before it was Bedbury with me not realising. And I just broke down. I had a massive panic attack in the car on the way to go out. I was pulling my eyes out and everything, which is really weird for me because I'm not normally like that. And I'll be laying in bed or I'll be doing something in the living room, and it's just like this blind panic hits me. I don't know what I'm doing, where I'm going, who I'm doing, what I'm not doing, that sort of thing. And I think I found going back to the gym's helping me a little bit, but I think I'm taking all my frustrations out when I'm there as well. Yeah. So it swings and roundabouts.
Mine was all in the supermarkets, the big supermarkets with all the lights and all the products. I found myself panicking, getting hot and sweaty. I'd never experienced a panic attack before in my life. I thought, what's happening? I'm going to pass out here. Didn't have a clue. Find myself walking down the dog aisle looking at cat litter and dog litter. I mean, I don't even have a dog.
I think I've been, although not to the extent of a panic attack, but I think I've also been through the same. I have this horrible feeling that I'm running constantly, like it's almost like I can never catch up with stuff. It's like and I'm very apparent that I live on my own. And when I had pneumonia a couple of weeks ago and I got ill again on antibiotics, and it's really difficult when you live on your own and you're ill because you haven't got anybody. When you need to go get milk or you need to go get medication or paracetamol, you've got nobody to go get it. Like I've got great friends, but I don't always want to get them. It's like if somebody's with you, it's when you're poorly, it's a lot easier. And I think I sort of have been very apparent, like, shit, I'm on my own kind of thing. And I very, very felt that very strongly. And it's a little bit of fear. I don't know, it come in a bit. I think they're re-looking at my diagnosis again. So they're unsure whether I've got something else going on, exactly what the cause was, the organs failing. And it's brought up a bit of stuff. So it's got more appointments coming up, but it is what it is. I'll get on with it and see what gets said.
I don't know whether or not with me whether the anxiety's just got worse because they suspect I have a fistula, so I've got to go in and have that tested. And I'm like, well, if it is, then I know what it's connected to, and I know that's going to be even more trouble because I know that they had to abandon the half a hysterectomy when I had when I had the surgery done because of the amount of scar tissue. And the fact that all my urethra and my kidneys and everything are all amassed in that ball of scar tissue. My pelvis is like floor concrete, and I'm just really worrying that the fistula is coming off of my bladder because there's nothing else for it to come off of. And I think that's half the reason why I'm panicking.
I tell you what, we've all been in the wars, haven't we? Really. My proctectomy went really well. That healed fantastically, so I've got a smooth bum. But the hernia repair probably lasted a month. It's back out again. This coughing, it's back out again, bigger than it was last time. All this coughing I've been doing, I've been holding my stomach, and even my hands can't stop it from protruding. So it's kind of like back to square one with that. The only saving grace is that my proctectomy went really well, so I've got to sort of thank for that. But I'm seeing my surgeon kind of the end of this month, so whatever happens, I'm having no surgery till next year now. That's it, I'm done with surgery.
I had somebody asking me the other week because they had both an incisional hernia and a parastomal hernia, and they was asking me because obviously I've had is it 5 or 6? I've had 5 or 6 hernia repairs in the last 10 years. And touch wood, this better be real wood for my cue, I'm telling you now. Touch wood, the last surgery, I've been all right. But I think half of that with me as well is I'm so paranoid about putting on weight, then I know that can exacerbate and cause the hernia to show itself that I've been keeping weight off. And they was asking me about the surgery. And I think the thing is, it really is luck of the draw. It's the repair's either going to work or it's not going to work. There's no way to guarantee that having another hernia repair is going to keep that hernia away, especially if it's coming back through like the same place.
It's not always. It's also not always about kind of like the weight. I think putting on weight affects it, but I do think that it depends on how the stoma is formed. It depends on there are loads of factors, because I thought the same. Like I had my hernia when I was quite small. I think there are different factors, and I identify with Steve in a respect of like my prolapse fail repair. It sucks. You go through the surgery, it's difficult. You have full abdominal sick. You may have complications. I know Steve and I did different complications, and then when it fails and it comes out again, you think, I've gone through all that, and then you go again and go again and go again. And I think there's such I think I read from Sue Blackwell's like 50% failure rate is quite high. And I feel like I suggested to Steve about speaking to the surgeon and saying, if it is a route again the other side, or it's difficult because if you don't know if it's going to come back. And I think if preventative measures, if it's going to come back, it's going to come regardless of what you do to prevent. But some people do have hernia repairs like Louise and are okay and don't have a problem. So I think it's just
it's also a timing thing.
Yeah.
It's kind of like I'm only you accrue time off in my work, so I've got to be good now for X amount of time before I can have even sick pay off. So
if I just put this into perspective for you, all of my hernias have always been in different places. The majority, I had an incisional hernia which was on my right side. That's half the reason why I don't have a stoma on the right. That, and it's held in with a shitload of mesh. The other 2 hernias that I had repaired when I had my resection, were along the original scar lines where I had the open wound. It was bulging up through the mesh, up through the dent in the open wound. And then the other two that I had repaired one was just left of, it was coming back up through the scar tissue for where they'd done the laparotomy. And I had another one lower down in my right side. But where I've got no large bowel left and where I've had that all taken out, and also because of my small bowel being adhered to scar tissue, there is nothing for me now for a hernia to come back other than my actual stoma. So, and I think because all of my stoma, it's only the tiny little bit that's coming out of my insides and a tiny little bit behind, obviously, my abdominal wall is actually free intestine. The rest of mine is actually adhered to a massive, great big ball of scar tissue. So that could be another reason as to why I possibly wouldn't get another hernia, because all the sides that were affected was mainly predominantly my right side and just off of right centre, and there's nothing there now for me to come out to give it a hernia. The only one that would happen would be around my stoma, but like I said, it's all adhered to scar tissue, so the likelihood of that coming out for me is pretty much like my scar tissue unfreezing and hell hell surfacing on earth kind of thing. So
sorry, Rach.
Oh no, it's okay, because I am changing the subject a bit. It's just before I forget, but do you want to say your bit? And
yeah, just really the fact that my stoma is completely different to the stoma that I had 3 years ago. Now my stoma decides to come out, go in. When I lie down, it goes back in. I never know. Because I've seen Rachel's stoma close up, I'm constantly thinking, you know, I see it coming out when I'm out in the shower, for instance, and I'm thinking, stop, don't come out any further, don't come out any further. You know, and I'm constantly worried now that that's going to happen to mine. It's like it's a bit anxious, but what will be, you know. You live and you learn, and you watch people do their thing, and ultimately you gain a bit of experience and knowledge along the way. So whatever's going to happen, I can't stop it. I've tried wearing all the garments and that, still got the hernia, so be it.
Can I just give it a little shout out? So our friend, and so that also knows Steffi, Chris Morrison. He's an Irish firefighter with a stoma. Yeah, he's watching. So this is good news. So when we were in Monday, Chris turned around to me and said, "Have you heard about Brian? What's his surname? Is it Kennedy? Yeah, Brian Kennedy, who had total pelvic centration, had 2 stomas." So I hadn't heard. Looked online and tweeted. Anyway, Chris has just messaged me and said he's been asked to go on the Stephen Nolan show on Radio Ulster tomorrow to talk about kind of about the reactions to Brian Kennedy and his own story. So I just wanted to wish him, like, it's great, because I think for me is I wish Brian Kennedy all the best in his recovery. But he has done a world of good, not just for Ostomy, but for Ostomy. We've never had national coverage. This is the first time Ostomy's been mentioned nationally in like any sort of live TV. So I'm just like super. I think hopefully this will be the thing that is needed, and you know, I feel bad that he's had to go through this, but I feel I'm really grateful that he's able to make it the platform to talk about it. So I just want to say, like, good luck to Chris tomorrow. And he said that I look exhausted, so thanks for that. That's what made me smile. Like, on Twitter, he said I look exhausted, thanks. But it's all the travelling. That's what it is. 5 hours to Peterborough. But yeah, just wish him all the best tomorrow, and hopefully I'll be listening. And yeah, it's exciting. I think things from the double ostomy perspective, ostomy are going to pick up now, which is good.
Okay, so tonight we are covering hospital scans, tests, invasive.
Really?
Yeah. Well, I did put and general stoma chit chat when I did the type up of the description on the link. So hands up for anybody that's had a gastroscopy.
Is that the one through the stoma?
No, that's the one that goes through your mouth and down your esophagus. So if anybody's had a gastroscopy on the live chat, if you can put it on there, because Graham's got one on the 21st.
What's the one that goes down the nose?
I don't know what that one is.
A nostril of esophagus.
So anyway, for those of you, if you're going for a gastroscopy, the best advice I can give you, if they say to you, don't worry about the sedation, take it. take the sedation. Don't be brave. Don't think I'm going to be all right. Just take the bloody sedation, because it is, if you do it without the sedation, it is one of the most uncomfortable things you will experience, because they numb your throat and you can't feel anything, and you feel like you can't breathe because your throat's been numbed. It just all sort of has that adverse reaction on you, and you'll laying there.
Can I interject there, please?
Interject with what?
You say take the sedation, right? But sometimes you don't have the option. The option was there, but I needed to drive my car. I couldn't stay in. So,
well, take somebody with you.
It's not always the case, because all my friends at work, you see. So,
I've also been in that situation. So I've had both, one sedation, one not. The one without was because I had nobody to stay over the night with me, and I couldn't get a lift back. The same.
Yeah.
But the one with sedation was much easier with sedation, but I couldn't arrange.
Yeah, but
I'll tell you what. Sorry.
You do know though, for most day surgery units though, if you choose to have the sedation and you've got nobody to take you home, you can stay in overnight.
They don't in Bournemouth.
They do at St Thomas's.
They don't in Bournemouth. Like it's quite very. They won't do it unless you have somebody there. They have to start. They have to like know that somebody's taking you home and staying the night with you. They're quite. So one time I had to do it without, but the one with was brilliant. Don't remember any of it. Was gone.
Yeah, that was fantastic. It's brilliant. By the way, the spray tastes like bananas, and you can't do gas in there whilst you're having a gastroscopy because you're having a camera shoved down your throat.
Yeah, no, I wasn't on about the gastroscopy.
Well, on a plus note, colonoscopy and endoscopy, I will never have to have one of those done again. Never again will a camera see where this. I no longer have an arsehole.
You know what, Louise? With the colonoscopy and sigmoidoscopy, the very worst one was when, after my bowel was removed and I literally had 10, 12 centimetres of rectal stump, they inflated it and they did like a little camera up there, and that was by far the worst pain I'd ever experienced in my life. It was horrific.
Have any of you ever, Rachel, you probably have, and this is probably, apologies for those that are watching before 9 a.m, whoever's had a double whammy. So one up the top end and one at the bottom end at the same time. Advice for that one: take the sedation. It is not pleasant, and I have to admit I was away with the fairies for hours after having that done. But I have to say that the flexi-sig was one of the most uncomfortable ones I ever had done.
That was my one. Yeah, that was horrible.
Did you know?
No sedation. Sorry.
Do you know the sedation they give you for the gastroscopy is actually a drug that makes you forget? So when I had the sigmoid one, I had fentanyl. But when I had this one, I was asking before or afterwards, and they said that the actual sedation they give you, it is pain relief, but it makes you forget. It's like it makes you forget your memory. It's not fentanyl, something else. So because I said, I don't remember. I said it's not that you were knocked out. It's like this drug specifically makes you not remember. I was like, I can't remember the name of it now.
That's ironic. You sure you actually had it?
Yeah,
has anybody ever had the barium X-ray? So for anybody that's on the chat, not necessarily on the show, no, a barium X-ray. So for those of you that have got fistulas in the abdomen, so any fistulas that are coming up the side of your stoma or coming up through your belly button, anything like that, they give you a barium X-ray. The reason being, you drink the barium, and what they do is they stick a nice little blue tube up through your fistula to try and locate the source of it. Now, they don't sedate you for that one. They don't give you anything for that. And then I remember, because I think I had like 2 a year with that, because they was always trying to locate the source of where the abscess started to cause the fistula in the first place. And I think I actually broke the doctor's hand, not his hand, but I actually think I broke his pinky finger. I was squeezing his hand that tight. And he said to me, "I'll hold my hand, it doesn't hurt." I'm like, "Do you want to swap places and lay here on the table, mate, and have that shoved?" I said, it's like I think the thing that I think with fistulas for me, the only way I can describe it is the equivalent of blowing a house through a straw. That is what it feels like because it's such a narrow tunnel.
Yeah.
I think colonoscopies and endoscopies. I think if you're not in flare and you've not got anything untoward going on down there, it's not too bad to have it done without the sedation. But if you are in flare and you are having issues, then go for the sedation. There's no point in making it any more painful than it has to be. And then you've got the discomfort after having it done as well, because they blow you up with air. It doesn't matter what you have up there, they're still going to blow you up because they have to blow the bowel up to be able to see and take biopsies and get clear images.
Now, why, oh why, right, and I'm quite squeamish with things like this, why do they face you in the fetal position towards the monitor so you can watch everything happening?
I love seeing my insides because I'm warped.
You can actually see the camera going into your own bomb. It's just ridiculous. I don't want to see that.
When I'm on sedation and I can't remember, I'm like, damn, I miss seeing it.
Oh dear,
I don't know why they do it. The only other thing that I can think of is as to why they have it that way is so they can see as they're going through. It's their way of navigating. That's why they're actually the way
my doctor actually looked at the camera, so I saw his face, and then he just sort of ran at me. It's like an Alton Towers theme park ride. It was ridiculous.
Now, Rachel, you've had one of these done because I know I have. The contrast and the tube down through the stoma.
Yeah, not in my because they couldn't do it through the prolapse, but I've had it through my urostomy. So I had my pouch came out, and then they put a catheter down, and then through the catheter they put the contrast. But we had a bit of faff because, again, the classic issue with the urostomy is that they don't know. They were telling me to drink, and I said, look, you really don't want me to drink water because if I drink, it's going to go everywhere. The contrast's going to come out, and like, there's no way. No, you have a bladder. You need to drink. I don't have a bladder. So when you're doing this in the waiting room, right? The radiographer is saying you have to drink. I can't let you in until you drink. So I go, okay. So I go over, get my 2 cups of drink it, thinking I know I'm right, but I don't want to argue in front of everybody. Go into the room, and the radiologist goes, no, you haven't drunk, have you? I went, to be fair, I didn't want to drink. It was them. They made me drink. And it just went everywhere because obviously the catheter and the contrast, and it wasn't too, like, the conduit is about that big, so it's not very long, but it was a bit painful when it got full because obviously it's not like an ileostomy like Louise, it's like longer, so it was all right. It got to see the kidneys.
You might want to tell people what the conduit is.
Okay,
so, I know, and Louise knows, but.
So when I talk about the urostomy, the medical term is an ileoconduit, but basically they take a bit of the small intestine and take it out of the body, and then they take the ureters from the kidneys and they attach it to this piece of intestine. So it's about 10 centimeters long. They then put that out of the body. So exactly like an ileostomy, comes out normal. So the ureter goes into the conduit, and then that comes out. And then and that forms the stoma, and then it comes out. So the conduit is the piece of intestine that is made like a conduit for urine. So that's why my urine have more chance of kidney infections and get mucus because it's a piece of bowel. And when you dipstick it, you can't. It shows an infection when it is an infection. So you have to go by symptoms because of the bowel.
Can I ask you a question, Rach?
Yeah.
You know, with your ileoconduit, you know, like stomas protrude. Most of them protrude. Okay, there's the ones that come out too much. There's ones that are, you know, are setting. But obviously, your urostomy is very flush. Are most urostomies like that, or do they protrude like normal? Well, like, you know, ileostomies or colostomy.
So that's a really interesting question. So most, I did a little poll in the urostomy group. I think there was about 80% used a convex pouch because most urostomy, did you think about the nature of it? It's 10 centimeters. They pull a bit out and it naturally sinks. So a lot of them are smaller. They're more flush to the skin. Some may even be completely in, like Vicky Palmer's is completely in. She has to have a catheter to help keep it open. That isn't always the case. But prolapse conduit is less common. then the kind of ileostomy. It does happen, but it doesn't happen to the extent of mine. But most are flush. I think it's the way that they fashion it, the way that the surgery is done. But it is interesting because most use a convex pouch. So when the pouches come out for urostomies and they're flat, there's kind of really needs a convex option, because the majority of us will have a convex, because it's the nature of the whole operation, I think.
Okay.
Good question. Just go back and see what the question, if we've got any questions. So Jennifer Higgins said, I never got the choice for sedation last time, just got gas and air. That hurt. Chris said, Steve, mate, you still got that cold.
Yeah, it's horrible, mate. All that
Elaine
beer that we drank didn't help at all.
Oh yeah, Elaine said that I love watching it as well. I think that's to do with the screen.
Oh, no, it's horrible.
Before I had my bladder removed and my urostomy, I watched the surgery, and I was talking about it last. I actually watched the whole surgery, removing my bladder, the day before I went in. And then the ironic thing is, when I had my first stoma, the ileostomy, I didn't want to know anything about it. I couldn't even talk about stomas. And then my second one, I'm looking at the surgery, I'm seeing the bladder getting removed. And
I could probably watch it now. I'll probably go back and watch the one that they had recently on. But as a whole, I'm quite tickle stomach with things and this is from someone that's worked in an abattoir for, when I was on my butchery course. I had to do like a period of time there, and that was didn't bat an eyelid. Now I've only got to see an animal on the side of the road, and I'm thinking about it for weeks. Completely changed.
Guys, just a quick one, because I'm running polls for it. I've been running polls for a blog post, and this is purely this wasn't to exclude double baggers. This was purely on a like ileostomy, colostomy, lefty or righty. What side is your stoma on? Purely because those with left-sided ileostomies are rarer than those that have got it on the right side. There's normally only a couple of reasons as to why they're stuck on the left, because right is considered permanent. And I find it weird when I see photos of people on Instagram or Facebook and everything else, when they're taking photos of their stoma, because their stoma to what mine is.
Well, first of all, the ileum is on your right-hand side. But a lot of these Instagram photos and that, the cameras switch it the other way around, so that can be quite confusing.
You say that, though, across all of the polls that I've done, I think there's only 13 people that have answered about having their stoma on the left. The other people that have answered, apart from the double baggers that have messaged me privately, I think it's something like 87% of people across all the polls that I've been doing have their stoma on the right.
Yeah.
And
I'm sure it's related to permanent and not, because I'm not. Where did you get that information from? Because I'm not too sure about that. Because when I first had mine done, mine was supposed to be like, because mine was a loop ileostomy with the hope of reversing, because they weren't sure, and mine was done on the right. And I knew a few others that had loops that were done on the right.
Well, this is what I was asking, because somebody was saying to me that it's predominantly colostomies that are left-sided.
Yeah, that's
ileostomies are right-sided. But
yeah.
My ileostomy, my last two surgeries have been left, and that was both with my loop and with my end.
That might be to do with your scar tissue, and all your surgeries, Louise.
I know why mine is. The less short bowel you've got, the less small bowel you've got, they can't stretch it. So mine is on the left because they can't get mine to site on the right because of the scar tissue and because of lack of bowel. And I know predominantly most people with the duodenostomy are also left because it's higher up, so they can't get it across to the right as they would site it. So I was just curious as to why those that had it put on the left. And then I had somebody telling me on Facebook the other day that those with left-sided ileostomies encounter more problems than those with an ileostomy on the right.
Really?
There's apparently more associated risks, but I can't see how there's any more associated risks with the left side versus right side. So
I always worry about unless there's data for it. It's like difficult to say. Like I could have, because I know that the urostomies are normally done on the right side because again the ileum's used for the conduit. Mine's on my left because obviously my ileostomy was on my right, so my left was used. But I know that generally they tend to try to do it on the right. It doesn't
What
always
do they
work.
with the urostomies?
Yeah, because
I
if you
never
think
knew
about
that.
it, ileum and yeah, it's tend to do it on the right. That's what
Okay.
the surgeons I work with say. So I was quite shocked because I thought what left was normal, but I'd be interested to see if if there is data on that, Louise. Like, have you looked?
I've been looking, but there is no data for left side versus right side, to be perfectly honest with you. I was just doing it more as an interest piece. I was just doing it more as an interest piece rather than a medical piece. Just like for those like sort of right-sided versus left, because I struggle with some of the clothing that is specifically for ostomies as well, just purely because when I'm left-sided, it seems to be that any pouch that are inside the knickers and things like that, apart from the Jasmine Stacey knickers, tend to be, if you're right-sided, the pouch sits okay. If you're left-sided, it doesn't. It's I don't know. It's just one of those things, I think, more than anything else. So that's just the way my brain works, I think. But it's because I think out of the people that have answered about being on the left-hand sided, as though there's a good proportion of those that are Crohn's patients that have had abscesses on the right-hand side and a lot of issues, so they've had theirs permanently sited on the left. So I don't know, it's a weird one. Whether or not there will be any medical data for that one in, say, 15 years' time, I don't know. But hang on, I think Graham.
Scans,
yeah.
MRI scans.
Let the bloke's got to keep us on track, Louise. We're like this. Come back.
Scans. MRI scan. Scare me to death.
This is the difference between a woman's brain and a man's brain.
I
I tell you what, there's a simple explanation to a woman's brain, and I'm being very diplomatic here.
You best be.
A man has boxes. He has a box for football, a box for sex, a box for work, and when he has a subject that comes up in his mind or a conversation that he's having with whoever, male or female, he'll go into that box. He'll go, oh, I know about football. I'll go to that box. Yeah, or I'll go to that motorcycle box. Yeah, a woman, right? All them boxes, they're all connected by one long string. And so, they'll go, oh, yes, I my husband does that, and he does that, and he was there, and he did this, and
okay,
and a man falls a bit when he hears that.
Okay, we'll go on to the MRI before you start blaspheming women. You get beaten up on the chat.
We're changing the subject now, are we?
Jennifer's just put that she's due to have a small bowel MRI soon, and she doesn't think she's had one of those before. They give you contrast.
Scare me to death. Yeah,
they give you contrast to drink for both small bowel. So I have a small bowel MRI and a pelvic MRI on the 27th of March. I've got to get there 45 minutes before my appointment because I have to sit there and drink 1.5 litres of contrast. Honestly, the MRI is not scary. You can give them a CD to play music through the headphones. So if you really want to torment them with heavy metal, do it.
You know what, it's scary. I find I'm quite claustrophobic, and having that metal drum like a centimetre away from my nose, I get like quite panicky and lying flat on my back. It's not nice. I don't like it at all.
I trained in radiotherapies, and we had to do a bit of diagnostic radiography and MRI, and some of our patients obviously had to go to MRI. This was before I became the patient. And a lot of people have a lot of anxiety and a lot of panic around MRIs, and around a claustrophobia and the noise and feeling locked in, and it's quite a bit. It can be quite a big thing. I think when you get used to being ill, you get used to it. You naturally kind of get used to it, But for some people that haven't had anything, like my grandpa, when he had an MRI, he was petrified, and they had to stop. They couldn't do it all the way through. And I think it can be quite scary because I think the magnet and is
I can deal with it. But my worst nightmare is like these people that do the potholing, and they're walking through really small caves. They're crawling under, and My heart's going just thinking about it. I can't even watch programs like that.
Right. An MRI, it's notoriously noisy. For those of you that are having anything bowel-related checked, pelvic-related checked, they will ask you at certain intervals, and that's normally when the MRI machine starts to get really, really fast.
They say, do you have anything metal in your body? And I'm thinking, oh God.
They will ask you to hold your breath for up to for a few seconds. I think the longest in my head, it seems like forever, but it's only something like 5 seconds. They ask you to hold your breath. They'll do the scan. They'll let you rest, and then the machine will tell you to breathe in, breathe out. Then it'll tell you to do it again. I think in total, dependent on what they're looking for, you're going to be spending anything between 25 to 45 minutes in that MRI machine. I've actually fallen asleep.
I'll tell you what, Louise, I was expecting my fillings to go flying out, and because it's a magnetic resonance, isn't it?
When I did my degree, they said a few stories, and I'm not going to repeat, but they said a few stories as to why it's important not to have metal, and a few about oxygen cylinders that people didn't think that got into the machine. Didn't hear anybody, just people not thinking. But oh my God, I meant to say something and I completely forgot. I meant to say something. Oh yeah, a head. To be honest, I find a head MRI scan the worst, because you've got this cage over you, because it helps get the imaging up. But I can't remember exactly the proper scientific term. But anyway, when you got that round and then you go in, I find the head ones with pelvis ones are okay. It's the head one because you can't really see, and you got this vein over your head.
The other one is as well, depending on which part of the bowel that you're having checked. Sometimes they'll make you lay on your front. Sometimes they'll make you lay on your back. If you're not able-bodied, and if you're like me, you struggle from getting from a complete lesion, what they do is they actually stick boosters and pillows in under your knees and stuff to hold them up, and they secure your pelvis down with blocks. But things like keeping your knees raised, and what they'll do is they'll stick a pillow under your bottom and under your lower thighs, just so that you're not sort of losing being able to hold your legs up that way. They do support you. If you are uncomfortable, they will talk to you throughout. They talk to you through the headphones. I think the most uncomfortable part of the MRI, more than anything else, is the contrast that they inject into your veins as you're going into the machine. And the last MRI I had, I caught flu.
I had one of them. You almost can taste metal. And then they were doing scans between heartbeats they were doing. But you could taste the metal in.
Have you noticed that? Have you noticed that with the contrast, it makes you want to pee? Now, when you don't have a bladder, that's a really weird sensation, because I haven't had a bladder, and it's like, oh, I want to pee, but I can't pee. I don't have a bladder. And I said, how is that? I don't understand how that works, because I don't have it. So I think it's the nerves and that, but it's really weird. Weird.
Have you noticed that in the scan environment, in the X-ray environment, it's very quiet. There's not much banter. This is what I've noticed. The last couple of times there has been, but every time before then, it's almost like in the depths of the hospital vaults.
Okay, so
go and have your scan.
For those of you watching, for any of you that get placed on immunosuppressants, you have to go through a series of checks beforehand. One of those is getting checked for HIV, having your bloods checked, and the other one is they check your lungs. Now, a lung X-ray is one of the most uncomfortable things you will ever have done, because especially if you're a woman with boobs, because they get you to whack yourself front on, up flat, standing up straight with the ball against you, but you also have to have both of your arms behind your back in a crisscross and have it out like that. That's uncomfortable, standing there and having that done, but they do that because they check for lesions and to make sure that you've not got any growths or anything in your lungs before they start you on the treatment. I think the most scary scans for me to have done is the CT scan, but that is just because every time I have a CT scan, there's something bloody wrong with me. So one of my CT scans, they told me I had severe septicemia, and they think my bowel was perforated. So don't remember a lot after that CT scan. So for me, I think the worst one out of anything is going to have a CT scan done, because I'm always worried that it's going to be the worst thing that they can find.
We haven't mentioned ultrasound yet, have we?
See, now ultrasound is a tricky one, because for some of us, if you like Rachel, if you've had a lot of surgery done and you've got a lot of inner scar tissue, an ultrasound is one of the most difficult things to have done.
It's not so much for me, it's more the kind of the difficulty I have with the sonographers here. So I put a complaint in a few years ago. Communication's being poor, they don't introduce the second person. I constantly feel like I sort of, they don't really listen. And I think for me, it's kind of like, I don't have a bladder. Oh, we'll just scan your bladder just in case. I don't have a bladder. There's no point scanning it.
You shouldn't tell them, you should say, what do you mean? I've got no bladder.
Did I move it?
Shit. Have another look.
Do you know what? Chris has just sent me a picture of somebody with an oxygen cylinder in the vein. I thought, oh my God, I better not send it if you're going to have an MRI. It's quite funny. Technician with the oxygen thing. But no, the ultrasound is, yeah. I think I find that the ultrasound can be quite painful. And also because I've had so much scar tissue, I can't see anything anyway.
No,
my kidneys aren't very clear.
They result to internal ultrasounds with me.
Mm.
And I've got to go for an ultrasound soon, and I'm not fancying that, because if the lady that's doing my smear test can't find my cervix, then what the freaking hell is me going for an ultrasound going to do to help that one? Short of getting a couple of holes, a mining lamp, and a very big shovel. I've got to laugh or else I cry. It's when the nurse is laying there for 45 minutes poking and prodding you, going, yeah, I can't see it. Yeah, you knew that 20 minutes ago. Why did you keep trying? I think ultrasounds, if you're all right, they're really good. If you've got a lot of scar tissue, and if you're like me, both of my kidneys are sitting in a massive great big ball of scar tissue, that's not fun for them to try and find. What else?
Chris has just sent me the picture, yeah, but unfortunately, I'm the only one that hasn't got the chat on at the moment, so I can't look at it. I can't do nothing. I'm missing out. I'm missing out on. I need to get my laptop up and running, don't I?
I'm missing out on saying here. Graham keeps saying.
Can I see a few scans that so has anybody had, maybe not, but or on the chat, if you had slow transit, you would definitely have had this, the marker test. So basically, you swallow. I'm going to put the chat up just to see, because I think if Jennifer's on, Jennifer, did you have the marker test for slow transit? You swallow a capsule and it's got metal markers in, and then basically what they do is they scan you an hour afterwards, then they scan you like 2 hours, I think 4 hours, 6 hours, and then next day.
Do you mean like a CCAT scan?
No, it's a bit different. It's called a marker test. So inside it's got metal markers. Basically, you see whether the bowel is slow transit. So when if it moves on, then your bowel's working. If it stays, then your bowel isn't. So mine just all stayed at the beginning of where my stomach was. And I even had it scanned a week later. It was still there. Like mine didn't move at all. And then it was about 2 weeks after that I had my stoma. It was booked in, everything, because they were like, no, that was the test that made me have my stoma. That was like years ago, 2012. But it's a marker test. And Jennifer said, no, I haven't had that one.
They use that one obviously for slow bowel transit. For those of us that have got fast bowel transit and things like suspected bile acid malabsorption, short bowel, that sort of thing, you have something called a CCAT scan. Now, what a CCAT scan is, similar to the marker test, they give you a little radioactive pill to swallow. And what they do is you swallow that, an hour after swallowing it, you have a scan done. 2 hours after, then they send you away for a couple of days, you go back for a scan, and then you go away for another couple of days and go back for another scan. And what they do is they test how quick those radiation levels, how quick that pill gets through your body. So if you go,
my transit is like 3 hours, and that's it. And I can literally have a Sunday dinner, and 3 hours later I'm playing with my peas. It's as simple as that. And that's how quick I can so I know if I've got a blockage. Almost, once the 4th hour has gone by, I know that I've got a blockage.
But this is the odd one with me. Is like my large bowel failed to function, completely failed. But now, like I eat the food, and it's within 20 minutes this comes out. Steve gets shocked at how quickly mine comes out, like within very quick. So it's like, although my large bowel failed, my small intestine now. I think it's because of the amount that was taken away.
Well, this is
Working
how
all the time.
quick fluid goes through with me. I
It's like
had
a
a
water
juice.
shoot.
You guys jumped on what, 5 to 8? I had a squash, and within 10 minutes of the show, I had to go and empty my bag. I also had a cup of tea that Ben bought me just before 8 o'clock, and I also had to go and empty my bag a second time. That is how quick fluids go through me, and it's the same with food, but it depends what I eat. Most of my stuff is normally out within half hour to 40 minutes of me eating it.
Okay. What time is it now? I've lost my clock.
It's 3 minutes to 9, and we started
How
2
many?
minutes late.
3 minutes.
3 minutes to 9, and we started 3 minutes late.
Can I quickly say something, because I feel like I need to address this comment. Jack, it's great to have you on the chat.
Who?
Have any of, am I saying it right? Have any of you had CBT counselling or any form of therapy to help you deal with the uncertainty of health? How did you find it? I'm struggling with one after. Have to wait 16 weeks for one-to-one CBT.
I've considered it, but I haven't had it.
I had CBT for 4 years. I have post-traumatic stress disorder. Mine's normally evolved around anxiety, stress, and if my health gets really bad, I still suffer with night terrors. I still get the odd panic attack and anxiety. CBT helped me manage ways to deal with that, because most of mine is nighttime related. So I'll have nightmares, I'll wake up screaming, or I can't sleep because my brain is playing, do penguins have knees at 2 a.m? Or, you know, boiled water makes potatoes soft.
Penguins have knees. Did you just say that?
Yeah, do penguins have knees? Obviously, that's what I lay awake thinking about at 3 a.m.
Just Google it. Just Google it, and then you won't have to think about that no more.
No, because I still struggle, because my brain would then go into something else, and the worst one for me is trying to get back to sleep.
Do penguins have elbows?
That's a good one. The things that I've adopted from CBT is I keep a notepad beside my bed, so if I'm having bad dreams or anything, I write it down.
What do butterflies get when they get nervous?
I'm also really organised, so I have things written down in a planner on calendars just to help me, so I don't panic and get stressed with things at short notice, because that's what sets me off. I found the CBT really helpful. Some do, some don't. It just depends on the individual case and what they feel they need. I also listen to Calm of a night time as well, so somebody talks me to sleep.
I think them apps are brilliant. I think the apps on the phone that are really good. The Headspace is good.
You've also got stuff on YouTube that's like sensory. So this YouTube video will talk you to sleep, and it feel like somebody's massaging your head, and other bits and pieces to help calm you down. But I found the CBT really helpful. But it is each to their own. So I'm not a group player for talking about mental health and everything else. I'd rather do it on a one-to-one basis. It's one of those things that I tend to keep bottled up more than anything else, just because on the face of it, I like to look like I'm normal and I'm coping, even though sometimes I'm really not. Just give it a go. It's okay. The group sessions aren't always great, but sometimes you might be able to glean advice from others with regards to certain things and try maybe their way.
It is trial and error, isn't it? To one person, you know, is a different. I think everything's worth a go. It's recognising that there's an issue first and foremost.
And being willing to have, like, you know, you also got to be willing and want to have counselling as much as it's suggested to you by other people. If you are not ready for it, you won't do it. And I think it's also I very much believe that when things get painful enough for you, you will do something about it. Like, things sometimes have to get painful now.
You've got to be open, and you can't be in denial about it. It's the only way it's going to work.
I think if you go to see a professional, then straight away you've made that connection. You've reached out. So, you know, so therefore you are being proactive in your own mental health. So that's the first and foremost, is go and speak to someone about it. Let them give you the options of what there is out there. And then you choose for yourself. You know, if it means going down the drug route first in order to be able to accept the CBT, then so be it. But I think finding out what's available is the initial, you know, port of call.
I'll be perfectly honest, I went for CBT rather than the drug route, just because you guys know I don't like taking my medication at the best of times. was.
I found that I couldn't even entertain the thought of talking to someone. I needed some. My brain, the imbalance of chemicals in my brain was at a point where I needed help in order to think straight, and talking wasn't going to copy it for me.
Hang
But
on,
that's me.
Dipax just put, I'm new to this illness. It's taking my job, my hobbies, friendships, my entire life. How do you pick yourself up, blow after blow after blow?
One step at a time.
Yeah.
Day by day.
Absolutely. What bite-sized chunks?
Your job, if you've, like you say, you've got IBD, your job, if you are struggling, you are covered under the Disability Act. Crohn's and UC are recognised within the workplace as a disability. You cannot get penalised for that. If you do, then you can contact a union rep and go along that route if you have one. They can't sack you. They can't force you to resign. If they do, then you can take them to ACAS for that.
Another good thing is reading other people's stories, people who've been through far worse than ourselves. And I tell you what, I've took great comfort in reading about people who really struggled through adversity and come through smiling, and I've took like massive information from these people, i.e. Chris, I read his story and it's about dealing with one bit at a time. Don't think of the whole big story because it's massive and you'll fall to bits. You deal with every little obstacle as it comes up, one at a time.
I also think that it's sort of like by sometimes having really small goals helps. So when I lost my job, I then lost the partner at the time, which was a good thing. I lost everything, and I felt
not me, by the way. It's not me.
No, that's not. That was another one. We don't talk about him. And I think I found that I was very stuck in the victim poor me cycle. I think if I had, sort of as Steve said, people that I could turn to, people that I could sort of see, talk to, that understood my journey, that probably would help. And sometimes small goals can help. So like, maybe like you said about your hobbies, maybe like now you're not working, maybe you could do a little bit of your hobby, like a tiny bit, and start building up. And with the friendships, I think we've all of us can say we've at least got a few people that left friendships because they can't cope with our illness. I think that comes with the territory of chronic illness. Doesn't mean it's right, doesn't mean it, but it's, I think you sort of accept that
it's part and parcel, isn't it?
Yeah, and to be honest, better friends will come, friends that you find, like a whole chronic illness community and ostomy community, if you have one or whatever, that is like, it's like the ones that are gone are replaced now with much better friends. Like, I've still got my really solid friends that have nothing to do with being ill that are here. The ones that maybe couldn't cope with my illness, it's like, it's funny how I'm big advocate, believe in life synchronicity and everything happens for a reason. And it's like, so that goes, something else comes in, and it's very much the flow and ebbs of life. Oh, look, I'm very hippie today, aren't I?
I think you just need to take it day by day. We have all lost something and part of ourselves along the way with our illness. I mean, I've lost chunks of my life spent in a hospital. I've lost the ability to be able to have any more kids. I've lost a lot of friends. I've had relationship breakdown because of it. I've lost a lot along the way, but it's about picking yourself up, brushing yourself off, and pretty much starting all over again. You don't have to reinvent yourself. You just be yourself, and those that are your true friends will stand by you. Those that aren't, then you might not have lost a lot in the first place. But your work, if you're worried about your work or you have lost your job, then there are ways around that. Hobbies, find a different hobby. If you can't do a hobby that you was doing because it was an active one, then find one that's less active. It's just about finding something else, and just finding something else that you can maybe find solace in, but it's just taking it day by day. We've all lost something along the way. It's just a case of picking yourself up, brushing yourself off, and getting on with it. And I think that's about it, really, isn't it?
That's it. Let's say ta-ra then.
Sorry, I had a quick yawn.
I've got my dinners waiting over there. I've got Mexican chicken with paprika.
We better let Gary's running late for his tea.
You'll see me in the next 2 Thursdays, because I'll touch wood, everything will be fine, and I'm not going to be ill. I'll let these guys obviously know if hopefully it'll be all right, and I'll come back round.
So we won't be on next week. We'll be on the week after, I think.
I won't be on then. So I'll be
you won't be here. We can sort something out. Just stay in radio contact. I'd like to say thank you ever so much to everybody that's watched this evening. For any of you struggling or just wanting to chat, our inbox is always open. So you've got Rachel at Rocking Two Stomas. You've got Steve. You can contact him over at Baghdaddy Steve. Baghdaddy Steve on Instagram, Facebook, and Twitter. I'm over at Crohn's Fighting. You're better off contacting Crohn's Fighting because I don't always check the page manager for the IBD and Ostomy support show because there's not really a lot of activity on there and it all gets muddled up in all the other notifications that I have to deal with. So Crohn's Fighting, yet again, Facebook, Twitter and Instagram, always on the same under the same name, on the same profile. And you've got Rachel on Rocking Two Stomas. For those of you that do have our personal Facebooks, obviously our messages are always open. Graham knows that because he messages at me at really random times of night. But other than that, we'd like to say thank you to everybody for watching. We'll be back again soon. Steve's getting really hangry and hanging out for his Mexicans, so we better let him get off. And we'd like to say thank you, and we'll be back again soon. So,
bye.
Bye. See you soon.